All right, so we're here for our next HED Talk. Today we have Dr. Krain, our Vice Chair for Education at UAMS, and he's also a geriatric psychiatrist at the VA. And he is going to be talking about teaching, active learning, and learning theory. So we'll give the floor to Dr. Krain.
Thank you. Yeah, so I do a lot of work with education and adult learning. And so when they asked me to do this, I said yes and figured I would kind of do one of my regular adult learning theory talks. And then I kind of did a little bit of background research on TED Talks and what TED Talks entail. And if you see all these people are all doing like dynamic things and interesting stuff. And this dude is a soccer ball and all kind of stuff. So I'm going to change it up a little bit. This is a little bit of an experiment. I'm still going to talk about learning. I'm really going to focus on kind of one concept. And this is a concept that I think really has changed me as an educator. Hopefully can change the way you kind of look at education. But we'll do a little background first. So we're not doing teaching active learning theory. We're going to do teaching with triangles. So we're going to talk about triangles as a concept. One of the things there's a lot of myths in adult education as you start teaching adults rather than kids. And the big thing is that teaching adults is just like teaching kids, just with bigger chairs. I recently did the parent-teacher conferences for one of my kids at middle school, and I had to squeeze into those little, do you remember those little tiny third grade chairs? Very uncomfortable. Teaching adults is very different than teaching kids, and you have to come at it really differently. The ability to do something well means you can teach that thing well. This is also one of the big myths. I think in higher level education like medical education and PhD level education, I think this is one of the big ones. If you look at the people that we work with as our primary educators, they're the experts in the field, which means they are the expert surgeons, the expert medical doctors, the expert researchers. And they know what they're doing really well. That does not necessarily mean that they can teach that thing really well. And I'll bet we can all think about a time when we had somebody who was very good at what they do and really struggled with teaching that concept. Teaching is a set of skills in of itself, and those skills can be taught just like anything else. It needs to be. I think one of the worst myths in teaching, and this comes from the medical field. Now, not everybody here is an MD, but we have this philosophy in teaching medical school called see one, do one, teach one. See it happen once, do it once, and then you can teach it. And that is pretty much the opposite of how human education and teaching learns. And so in medical academic setting, I think there's a lot of bad teaching that goes on. And so I want to sort of get at some of those. Teaching adults can be really frustrating at times. And when I talk to students, learners, residents, fellows, even faculty, oftentimes we end up talking about the things that are really frustrating. And I wanted to, if you just take a minute, sort of think to yourself about kind of some of the frustrations that you have had trying to teach. And I think almost everyone in this room or on this call at some point has had at least some teaching opportunities. And so, a lot of times it's something that goes like this. They're not interested, they're not engaged with me, they're not listening, they don't care about what I'm trying to teach them. It's frustrating because there seems to be a disconnect between the teachers and the learners. And that disconnect is often sort of framed as difficult learners or bad students or they're not bright or they don't care. And I think that is actually a misconception about how we're connecting. And a lot of this today is a look at a different way to formulate kind of how teachers and learners interact. One thing about teaching is that it's been going on for a long, long time, and there's a lot of ancient wisdom to be had. And so I always like to go back. So these are pyramids, and there's a lot of ancient wisdom that we can get here. Not this kind of ancient wisdom, which would be very, very cool. This is from Stargate, which is one of my favorite shows. Actually, it's more about this, which is triangles itself. The pyramids are triangular design, and you'll see triangles a lot of places. And triangles are really impressive structures because they do some very interesting things geometrically. They have, this is a look at load and compression and tension. And the big thing about triangle is that because it's wider at the base than at the top, it has a big sense of stability. And that sense of foundational stability is a really good concept in the way that we think about design of almost anything. You see this triangles in nature a lot. And again, this concept of a foundation being stable or things widening and the way that we work that. And then consequently, we see it in engineering. And even things that are not triangular often incorporate triangles in their structure. And so I think about, they're my favorite shape, but I like to think about triangles. And I have one particular triangle that's my favorite in terms of education, and it's this one. Does anybody know what this is? If you're in the audience.
The hierarchy of needs, Maslow's hierarchy.
This is Maslow's hierarchy of needs. Maslow was a psychologist, 1908. I love this picture because he's so happy. And in fact, in all the pictures of Maslow, he's really happy. He's considered one of the first sort of humanists. And he laid out this idea of a hierarchy of needs. And this is a kind of a structure of human psychology. And it's basically that there's a set of foundational and then rising needs that all humans have. At the very base of the triangle are the physiological needs: air, water, food, shelter, sleep, clothing, the ability to reproduce, sometimes sex, that kind of thing. And then at the next level is personal safety, security, the ability to get resources for yourself and for your family, the kind of longer term survival kind of stuff. Next comes love and belonging, friendship, intimacy, family, connection, that kind of thing. Rising to esteem, which is getting respect, both self-esteem and status, respect from others. And then rises to this degree where he calls self-actualization, which is kind of like being the best you can be, the most you can be. And he described that self-actualized people as awesome teachers, people who are interesting and fun to be around, those kind of things. And I find this really, really helpful. And one of the things Maslow said is you have to fulfill someone has to be comfortable with the base of the pyramid before they can function at the higher levels of the pyramid. So you have to have somebody with their concerns for air, water, food, and shelter met before they can start thinking about employment and their long-term health and that kind of stuff. And those need to be met before they can start thinking about family and intimacy and that kind of stuff. So he really described this again as a sense of foundation. And one of the things he said is, if you try to engage someone on a level higher than where they're at in terms of their concerns, you're going to fail in that, in connecting with them, because they're just not doing that. And this is a great, I think, psychological construct. How does this work with teaching? Well, I think there's also an educational hierarchy of needs. And this is the one I use for medicine. We can spin it out to other disciplines, but I think people will get the point. At the very basic is, don't kill anybody, right? Physical survival. We have jobs that involve healthcare, that involve working with patients. And kill is a little bit dramatic. Don't harm anyone would be part of this. And we think of that as one of the first rules of medicine: do no harm. Then the next level is, don't fail out, right? The learners are here in a training program. And all training programs have rules and they have expectations. And in order to complete your degree and to get where you're going, you need to complete those expectations. So don't fail out. Once you've taken care of that, then you can think about doing well in that program. But you don't really care about getting a B in a class if you're really worried about getting an F in the class and failing out of the program altogether. And so worrying about doing well comes secondary to worrying about just making it. Once we have that assured, then you can start thinking about being good at what you do, right? We all came here to be a doctor, a social worker, a researcher, in some capacity, those sorts of things. And so, getting good at that thing becomes important in that capacity. And when you got all that covered, then you can start thinking about contributing to your field, and that can be being a teacher, being a new researcher, and that kind of stuff. And so just like in the psychological hierarchy of needs, you can engage someone on a level of, their family, their intimacy, that kind of thing, if they're worried just about where their next meal is coming from. You can't teach someone what it's like to be a good doctor if they're worried in a moment about just losing a patient, for example. And we see this over and over and over again. If you've ever had a teaching moment on call where you're very worried about a patient and somebody then tried to engage you on the future of SSRIs in medicine or the research pipeline in antipsychotics, you've thought to yourself, this is not the time, right? And this concept of, well, this is not the time, or that's not really where I am, that's really about this hierarchy, right? And so I want to think about that as we step back, then thinking about applications of the hierarchy of needs to education, right? This education hierarchy. So learners, by nature being learners, they are working their way up the hierarchy. And they can function at different levels at different times. And that's one important thing to notice. Just like, well, I'm worried about getting lunch right now as a survival need, but once, I'm fed, or maybe have enough money to pay for food for a few days, I can start thinking about housing and some of those other things. Right before a test, I'm really worried about failing out of class. Once I've passed the test, I can think at sort of a little bit of a different level for a little bit, but if another test is coming, I'm gonna move back down the hierarchy in that way. So learners are operating, again, on this hierarchy, and they're kind of working their way up. They have difficulty incorporating teaching that is above where they are at the hierarchy now. And so again, if you think about how and where to engage them, you need to take a step back to think about at what level they're functioning on the hierarchy. If a learner is in survival mode, you can't talk to them about the cool conference that's going to happen in a year that maybe they could go to if they get a scholarship. They want to know that they're not going to fail out of the program. You have to talk to them about their program needs and those kind of things. Educators, by nature of being educators, are usually operating at a higher level on the hierarchy than the learners are. They've already passed through many of the basic rungs, and they're often operating, at least on a career level, higher on the triangle than the learners are. Now, we all know that educators themselves have survival needs within their career and that kind of thing, and that does come into play as we are being teachers. But in general, the educators tend to be at least have a sense of what it takes to be good at their field. Again, they're often here because they are good at their field, being educators. And what that means is there can be a disconnect between where the educators are functioning on the hierarchy and where the learners are functioning on the hierarchy. And that creates a tension. It creates a tension of sort of the material and the priorities of the teacher and the learner in that sense. And one of the times I hear people talk about, oh, the students are not interested, the students are not engaged, the students, they're not listening to me. I often say, what kind of thing are you trying to teach? And it ends up being something on a higher level of the hierarchy than where the learners are at that particular moment. If you, again, I find it very interesting to think about, I'm a geriatric psychiatrist, expanded treatment options for dementia that are coming in the pipeline, the treatment, developing and emerging treatments for dementia, what we're going to do about that, what dementia care is going to look like 10 years from now is very fascinating to me. But if I try to engage a medical student on that the day before their final exam, they're going to say that I've wasted their time. And then we walk away where I feel like I was trying to teach this learner something and they weren't listening, and the learner feels like they were trying not to fail out of school and I was wasting their time with something that was not testable. You'll hear learners refer to this kind of concept when they say something is high yield, right? Sometimes you hear about high yield information. And that's high yield is stuff that's relevant to right now and is going to help them meet some of their needs. Low yield stuff is stuff that they acknowledge is information, but not going to help them, on the hierarchy in that moment. It's always very useful to step back and think about, as I'm going and teaching someone, where are they in the hierarchy, both in terms of development. Are they undergraduate students? Are they graduate students? Are they fellowship level students? Are they junior faculty compared to where I am? And where does that put them basically on the hierarchy? And also, where are they right now in this moment? I work at a 6-week medical student rotation, so new students come every 6 weeks. And then at the end of the 6 weeks, they have a test. Where are they in the first week of that rotation? They don't know where they are. In a way, they kind of have a housing need crisis, right? They don't know what they are. They don't know what their basic expectations are. They're very much in just kind of survival mode in the sense of the hierarchy. So I have to get them oriented. I take time orienting them, showing them around, teaching them the basics of things like notes and interview skills. As the rotation goes on, they become comfortable with their surroundings. We can start talking about diagnostic aspects of mental health. We can start talking about treatment aspects. And you can see they're comfortable enough with the daily routine that they don't have to worry about where do I need to be in 15 minutes. And they can learn material. As we approach the end of the 6-week period, they start getting nervous about the final exam, and they live in this zone of I don't want to fail out, and somewhere between I don't want to fail out and I want to do well, right? And again, now we really need to talk about the details of that test. And as I engage them with kind of the interesting aspects of this particular interview that they're never ever going to see again, or the implications of this in the big picture for how we conceptualize depression, they're not really that interested in that. They want to know what kind of stuff is going to show up on the test. And educators are repeatedly stymied by this, like, is this going to be on the test? I think that's sort of one of the most hated questions in education, is this going to be on the test? But I would ask you to step back and sort of think about that question, right? That question, is this going to be on the test, tells you that learner is worried about their survival in that moment. They're worried about their survival and the basics of their performance, and we need to engage them on that. I could switch that by saying, why are we offering them a test that's not important enough to teach the material, right? So if you don't value the test, but you're putting great value on it, that puts them in a situation where they're valuing something that you don't value. And so we need to think about this. Where are the learners? Where are they on the hierarchy in that sense? So this tension. Yes. The fascinating thing about the hierarchy, and one of the things that Maslow said again is, when you think about people with the hierarchy functionally, as you meet someone's basic needs for housing, for shelter, that kind of stuff, they'll start to think about things like their career, what their long-term plans are going to be. As those things come into mind, they'll start thinking about their social situation, friendship, intimacy, and that sort of thing. So one of the things is, you don't need to move someone through the hierarchy. If you help them meet their needs at a level of the hierarchy, they will naturally start looking to the next level and exploring those needs as well. And the same thing is true for education. So while we're frustrated that we want to talk about the future of mental health and they want to talk about what's on the test, what you find is you don't have to convince them that the future of mental health is interesting. If you convince them that they're going to do okay on the test, if you give them what they need to do to prepare for that, they will start actually naturally exploring the next level of the hierarchy on their own. So we don't need to move them, right? We need to make them comfortable where they are. We need to meet their needs at that level, and they will naturally kind of rise to the next level. And so helping people progress on the hierarchy is not about even envisioning the hierarchy per se as something that we help them with, but really envisioning the level that they're at right now and getting that met. So I started by talking about triangles. And I think triangles are really interesting. And so if you're going to do a talk about triangles, it's natural to have 3 things in a talk about triangles. So I actually had 3 learning points in this talk. The first of which was the hierarchy of needs. And I realized it was getting too cramped. And so I'm actually going to leave us with this one concept today, the concept of the educational hierarchy of needs and meeting your learners where they are. And I'm going to fall back on another good rule of 3s, which is trilogies. And I'm going to assume that I will be invited back for a HED talk 2 more times. And at that time, I will talk about some other of my favorite triangles in education. So thanks for coming to my HED talk. That's what I've got, the educational hierarchy of needs. And rather than a whole curriculum of adult learning theory, I'd like you to just kind of think about that for the next couple of weeks. I would love to talk to people about it. I'll answer emails about it. You can stop me in the halls. But this is one of the places where I think we are really at disconnect with our learners. And when we talk about challenging situations, to try kind of envisioning that educational hierarchy and think about where we are on that. And we'll take questions.
Thank you, Dr. Krain. Could you go back to the hierarchy of needs slide, the education hierarchy of needs slide? So what I think you did a really good job on is kind of explaining the kind of core issues going on in certain situations. Like, for example, how we as physicians really want to teach med students how to be a good doctor, almost up to the top there. But oftentimes, like you emphasized, they often just want to get good grades, they want to pass the test. Conversely, as residents, they want to progress up that hierarchy of needs, but if they're on a rotation where maybe expectations weren't set clear for them, they may feel really insecure and they may not be able to move up, that hierarchy. But I wanted to ask you, at least from a med student perspective, med students most of the time aren't at the bottom there on the don't kill any patients because, we haven't quite given them the reins yet to make those decisions. However, they are often at that second part of don't fail out of school, don't fail out of, my training. And I feel like you do a really good job of making med students feel secure. And I kind of wanted just to ask you, how do you go about on your geropsych unit making med students feel secure so they can, like you said, on their own kind of move up to the next part where they can get good grades and all that?
So let me say a couple of things about what you said first, and I will get back to that. So one is, I have this discussion sometimes about what is survival in education. And you're right, not everybody is in a position to not kill patients or that kind of thing. And again, I'm aware that this is a multidisciplinary talk and people have different experiences with patients that may be more urgent. I have that rung in there because I think it relates to call and to some of which means on call. But you can certainly conceptualize just basic academic survival as a primary need, right? So we could basically put not failing out of school on the bottom of the hierarchy in that way, and kind of move up from there. And I think that's just as valid a model in that sense. And yeah, like you said, nobody envisions going to medical school or going to social work school or being a psychologist to get an A in gross anatomy, right? Nobody I talked to in my class was here to ace physiology, right? We were all here to be medical practitioners, to treat patients and things like that. So how do we get so mired in this, this kind of, and again, it's because that seems to be the key to our survival. And so what do I do in my unit is, again, I try to keep this in mind. And so if you ever worked with me as a student, one of the things I often start with is, where are we in the rotation right now? Is this week 2? Is this week 3? And I sometimes lose track of that. I probably should know it offhand, because that tells me, again, roughly where people are going to be. I relate to the students very differently at the beginning of the rotation, the middle of the rotation, at the end of the rotation. Another thing I'll tell them, and if you're working, as a med student, I often say, like, if you pay attention to my didactics, you will get what you need to know for the test. And so what I do there is I try to assure them that, if you stick with me, I'm going to give you what you need to pass the test. And I'm going to give it to you in this place. So when we're talking in another format, like on rounds or right after a patient, we can talk at a different level, because this is not sort of the survival moment. I'm going to make sure that you have your food, your water, your shelter, so you can, put that aside from right now. Today I'm going to talk about something bigger. And again, if they're comfortable that they're not going to worry about those things, even if they don't have a handle on it now, even if they're not ready for the test right now, they can put that concern aside and kind of operate on a higher level for a little bit. Now you have to keep that promise, right? You can't go through rotation saying, oh, if you stick with me, I'll make sure that you ace the test. And then be like, good luck on the test, bye, right? And so one thing I'll also do is I do a test review at the end of a rotation. We talk about the kind of things that commonly show up on it. I don't teach the test per se, but I review their questions and concerns. I let them ask me what they're struggling with, that kind of thing. And my hope is, as I do that at the end of each rotation, because students talk to each other, that they say, oh, Dr. Krain does a good test review at the end, so you don't have to worry so much in the middle and that kind of stuff. And I do find that, people have said to me before, I don't want to miss this last session with you because I've heard there's a good test review there. And so I just make sure that they're ready for that.
Thank you.
Other questions? Other questions in the chat?
Not yet. If anyone has any questions on Zoom, you can put them in the chat and I'll ask Dr. Krain for you.
I got a couple of texts. Let me make sure nobody texted me questions directly.
Can we get like a preview of like what the next 2 talks could be about?
like a trailer for the next episodes of the
Yeah.
trilogy. Yeah. So my next favorite triangle in education is the disconnect between the kinds of things that we learn and how we teach them. And I think one of the big conflicts in medical education is this concept of classroom learning about things that we do, like interview people, or if you're a surgeon, do surgeries. I think the most boring classes that I had were the lectures about how to do dissections and gross anatomy. Do you remember these? They would sit you down and then they would talk for 20 minutes about what we're, you just, that kind of thing. So I think there's really three types of learning that we have. We have didactic learning, which is knowledge. We have procedural learning, which is doing specific things. And then we have behavioral learning, which is sort of attitudes and that kind of stuff. And each of those things is a different kind of teaching. So the classroom teaching works for didactic learning, for knowledge-based learning, but it doesn't really work for procedural things. What works for procedural learning?
Doing.
Coaching, right? Doing it, and then the teaching and doing is called coaching, right? If when you're doing knowledge-based information, it's the facts that you know. And you either know it or you don't know it to some extent. You can know different depth of information, but again, like if I know the 3 parts of the small intestine, then I know the 3 parts of the small intestine. But if I'm going to be doing a laparoscopic surgery, it's not just knowing that, I can do it better, and you never really do it the best, right? You're always sharpening the skill, so that's coaching. And then how do we teach behavioral things like attitudes? Modeling. We model attitudes, and modeling is actually one of the big errors we make in teaching. And so another big point that I find when people get frustrated in education, either as learners or teachers, is they're trying to teach one of these categories with one of the other skills. And the biggest one is teaching a procedural thing. For mental health, it's often interview skills in a classroom format, rather than, we do our best teaching on the boards.
So, Matt Kern, your prior Jerry Psych fellow,
Yeah,
asked, how does Dr. Krain see the role of scalene triangles in his educational paradigm?
Well, Matt knows, because I'm OCPD, that I love equilateral triangles best of all the triangles. So let's see, scalene, which are scalenes? They have 3 different sized sides. I will certainly acknowledge that in certain teaching methodologies, one face of a triangle may be a larger size than another, and we need to be flexible with that.
That's a good answer.
I will not make any comments about difficult learners to Matt Kern.
Matt Kern said, smiley face, thank you for this wisdom. That's pretty good. Well, we're at 12:30. I think we've reached our time limit. So thank you so much, Dr. Krain. We appreciate your time, and thank you for everyone on Zoom for being here and the folks in person. So thank you.